Free doctor visits for under-14s are at risk of being scrapped, along with other essential services, as GP clinics struggle with spiralling inflation. The General Practice Owners Association says services are at risk if government funding doesn't increase. Ashley Yates has more.
Children aren't the only ones feeling a pinch. GP clinics are too, financially. Mounting costs are threatening to end free doctor visits for under-14s. Clinics can either opt in or out of the scheme, which is subsidised by the government.
Your costs are going up and your income is either constrained or even in some cases going down, then you struggle to maintain a viable business.
Dr Angus, who represents over 1,000 private GP and urgent care clinics, says government funding isn't keeping pace with inflation. The latest subsidy increase was just 2.78%.
Of course, that's nowhere near even inflation, let alone the cost pressures that are coming into our particular sector.
The Health Minister says the government's been committed to funding doctors.
We have put a lot more into GP practices than was the case before. They get to negotiate their funding contract with the DHBs every year, so that's the opportunity for them, if they think they need more help, to negotiate that.
But if they can't, other essential GP services are also under threat. Low-cost visits for community services card holders, childhood immunisations and flu jabs, management of conditions like diabetes and cervical screening.
Suggesting that maybe women won't go for that screening is very worrying for the future of women's health.
We'll continue to work with GPs on making sure their funding contracts reflect the real cost that they face.
But if GPs are forced to cut services,
it would be upsetting.
Another sector being squeezed by rising inflation. Ashley Yates, Newshub.